My dear patrons, I would like to thank you for supporting my channel and my work here. And as a little gift for you, I publish one video for my patrons only every month. And the March video is about the oblique meniscomeniscal ligament. By the way, your guys are awesome. This time I give you a like. So before you ask yourself why this video is still on YouTube, you're right, it's on YouTube, but it's listed as private and only people with this link can actually access it. I haven't figured out the other way yet to make my videos Patreon only. So technically, if you share the link, somebody who is not my Patreon can also see the video, but I would like to keep this private. So let's have a look here at this patient. And now the oblique meniscomeniscal ligament always runs from the posterior horn of the lateral meniscus, here's the lateral side, obliquely through the joint between the ACL and the PCL, and then inserts here into the anterior horn of the medial meniscus. So again, it's running from the posterior horn of the lateral meniscus between the ACL and the PCL, and then inserts at the anterior horn of the medial meniscus. So let's see whether we can actually see it, because there's one pitfall, and sometimes the posterior horn of the lateral meniscus has an insertion that's inserting here into the intercondylar eminentia, but it's not the case here. So you can still see here this dark dotted structure. There it is. Then here, this one, and then here it's inserting. So especially you can see it here, check. And we can also correlate this on our sagittals. Again, we are on the lateral side, and we can see that there is a structure here running deep into the joint and then inserting here. So it's very thin here, so it's not a very prominent structure, and then it's inserting here. And also on your axials you have the structure from the lateral meniscus, posterior horn, obliquely running through the joint, inserting into the anterior horn of the medial meniscus. That is the oblique meniscomeniscal ligament. So this is another case, and again, here's the lateral side, and this is the lateral meniscus, the posterior horn, and you can also see a black structure running into the joint, but this time it's inserting here, and it's not going all the way to the anterior horn, so you're not really seeing this connection because it stops here. And also in this case here, yet another case, you have the posterior horn of the lateral meniscus having some bundles inserting here into the medial peak of the intercondylar eminence. So the oblique meniscomeniscal ligament is important not to mistake as a pathology. That's basically the reason why I showed it here. And you don't want to name it as a displaced meniscus fragment when in fact it's just a normal variant. So have it in mind, and I hope it helps you when you have a case like this someday. Okay, my dear patrons, thanks for watching, and don't forget, every month you have a vote for the next video, and keep supporting, it's very much appreciated. See you next month.